Our next speaker is Cody Walters. Throughout the quarter, we have heard Cody speak on the topics of obesity and his uncle. We have also learned that he plays basketball and is a great bowler. Cody first became interested in rickets disease when he found the disease on WebMD a week ago. Ladies and gentlemen, please welcome Cody Walters.
A 12-year-old girl living on the Isle of Wight in southern Great Britain developed the vitamin D deficiency disease, rickets. The child obtained rickets from her mom putting too much sunscreen on her on a day-to-day basis while going outside. The overused sunscreen acted as a barrier to any nutrients that the sunlight could bring, including vitamin D. This is a true story that was posted in an article on the New York Times website and that they did in 2008. While uncommon nowadays, rickets in the Western Hemisphere, the attainment of rickets can still happen. Rickets is very scary. We'll talk about what rickets disease is, the symptoms, and its treatments. Rickets is a condition that affects the bones. According to WebMD's website, copyright dated 2012, rickets is a disease that weakens the bones of young children. Stated further by aforementioned, rickets is caused by having a vitamin D deficiency. Some problems with the absorption ability may cause a vitamin D deficiency. Stated by medicalnewstoday.com, copyright dated 2008, if the disease becomes serious, bowel legs may occur. As you can see, this is a picture of a normal bone, straight, and there's less spongy texture in the bones. But with rickets, your leg bones kind of go inward like that, and it's like permanent once you get it. And the bones inside are kind of like more spongy and spread out more, which makes it more brittle. According to Mayo Clinic's website, copyright dated 2010, rickets disease has many risk factors. Stated further by aforementioned, children of ages 6 to 24 months old are more at risk for rickets because their bones are still growing so rapidly. According to Dr. David Pearlstein in an article from medicine.net, copyright dated 2009, babies who are born premature and having darker skin have a higher risk to attain rickets disease. The aforementioned went on to say that people with darker skin are more at risk to attain rickets because dark skin does not react as strongly to sunshine as does lighter skin, so it produces less vitamin D. We just looked at what rickets disease is. Now let's talk about some of the symptoms for the disease. Rickets disease causes pain in the bones. According to the website of University of Maryland's Medical Center, copyright dated 2012, the symptom of rickets is delayed growth of bones. The aforementioned went on to say that some of the other symptoms are pain in the spine, pelvis, legs, and muscle weaknesses in children are sometimes caused by rickets. Rickets disease also causes skeletal deformities. Stated by Mayo Clinic's website, bowed legs and having an abnormally curved spine are skeletal deformities that are sometimes caused by rickets. Mayo Clinic also stated that thickened wrists and ankles and breastbone projections are also skeletal deformities that rickets could cause. We just looked at some of the symptoms of the disease. Now let's look at some treatments for it. The treatment of rickets fits into two categories. First is the natural treatment, and then there's the drug treatment of the disease. First, let's look at the natural treatment. According to Dr. David Pearlstein's article on medicine.net, sunlight can be used to treat rickets because it contains a healthy amount of vitamin D. Pearlstein went on to say that certain foods that contain vitamin D can also be used to treat rickets, such as fatty fish and egg yolk. Rickets also has available drug treatments. According to WebMD's website, copyright dated 2012, taking vitamin supplements will help, and also taking calcium supplements will help. To summarize, we have looked at what rickets disease is, its symptoms, and some treatments available for the disease. Like I said before, rickets is very scary. Rickets disease has been around for many centuries and will continue to be around various parts of the world due to a lack of vitamin D in diets. Just because rickets isn't relevant today does not mean it will be irrelevant